This question is regarding what can I do for SI joint pain. Now, for people who don't know what SI joint pain is, it's called sacroiliac joint pain, and it's more or less in the back around your hip area. It's very common, especially when women are pregnant, but first of all, I would want to find out what's causing my SI joint pain. It's basically low back pain to the left or the right, not where your spine is, but a little bit lower on your hip area. So the first step is evaluating and determining, what that could possibly be. Now, are you overweight? How much do you exercise? What I would find when I had my clinical practice with SI joint pain is sometimes they do have compaction and constipation in the bowel area, which pushes on the excess pressure on the back of the SI joint, and that can cause pain. Another overlooked, very overlooked, common cause that I would find of SI joint pain would be a malfunction, believe it or not, in the feet. If you have flat feet, first of all, I would check the feet, and usually I would use a company called foot levelers for that, and take a mold of their foot. First of all, I would measure the distance between the ground and the arch, and I would watch them stand, and I would look at their shoes to see if they were wearing on one side of their shoes. Very common and very much overlooked. Doctors focus on that individual area when a lot of times the pain is coming from another area somewhere else. So as a chiropractor, I would have check the feet, adjust the bones in the foot, adjust the ankles, the bones in the ankles, every single joint all the way up to the waist. Then work to the knees, then look at the hip joints. Pretty much 100% of the time I would find what was causing the SI joint pain by looking at the hip joints, the knee joints, or the ankle joints. So that's maybe something that you want to do, and I would definitely recommend finding a chiropractor that could evaluate all those joints and determine where your pain is coming from. Not sure, what I would also do is an MRI. I would also, just to make sure and to check to make sure there's no lesions in there. Also, the small bone at the end of the sacrum of the spine is called the coccyx. A lot of times, this is what people call their butt bone. A lot of times, the coccyx is out of position. So you might want to talk to or have that evaluated well, and sometimes that can be adjusted with just a light pull and be popped back into position. So there's a lot of different factors that could potentially be causing SI joint pain. A couple others are very tight muscles around the pelvic area. Check the psoas muscle, check the piriformis muscle, check the quadriceps muscles, the hamstring muscles. And another very much overlooked muscle is what I call the TFL, or the tensor fascia lata. And it's the muscle that runs from both hips all the way down and connects on the side of each knee. Those muscles, when they get tight, can pull on the hip joint and cause excess pressure within the sacroiliac area. Hope that helps. Thanks.